Fast food is going to cause type 2 diabetes. It's going to decrease that sensitivity of the cells. So it's going to get all this poor quality fat and it's going to get all this sugar, and your cells are going to be like, hey, I can't do this anymore.
So
And
I
that's why it's
imagine
happening so young, because they're doing it from a very young age.
You're watching the Dr. Jake podcast. Everyone, welcome back. I'm Theresa. I'm a mom, I'm a health nut, and I'm a wife to a cancer fighter. Sitting here today with Dr. Jake of Integrative Medica to talk about type 2 diabetes and what your doctor may not be telling you. Dr. Jake?
Yeah, so I'm really excited to be able to talk about type 2 diabetes because there's so much we can do with this condition, and you don't have to depend on medications the rest of your life when you have this. So it's going to be a lot of fun to talk about that today.
And you've treated a number of patients with type 2 diabetes before?
Yeah, so one of the patients that I have treated that I want to talk about today, her name is Judy. So she came into me with all kinds of things going on, but one of the things that she had was type 2 diabetes. It was very difficult for her to manage. Her blood sugars were really high. Her hemoglobin A1C was at like a 9. Her blood sugars were consistently the 200s. She was just following the typical protocol. She was following the typical high sugar diet. She was on metformin and insulin, but her blood sugars were still way too high following this protocol. When I saw her, decided, okay, we need to put her on a low carbohydrate diet, which she was resistant about at first, but I was able to convince her of how well she was going to feel when she was able to follow this diet. We also gave her some herbal things that can make it easy to be able to balance your blood sugar, like berberine and alpha lipoic acid and benfotiamine and things like that. Maybe we're talking more detail of those in a sec of how they work. We gave those things, and then we kept her on her medications too at this time. We started noticing that her blood sugar started to improve in about 2 months, that her hemoglobin A1C was getting into the low 7s, and her blood sugar was consistently in about the 150s to 180s. So things were looking better. I was like, okay, I really want to see how you do without your insulin. I did a test to make sure she still was producing her own insulin, which she was. So she didn't absolutely have to be on insulin. So we took her off her insulin slowly. And then we got to a point that she didn't have to be on her insulin and still maintain the levels that she was at. And then we kept her on her metformin, but we kept it on a low dose. And her blood sugar was able to get right below in the upper 6s of a hemoglobin A1C. And then we were able to get her blood sugar in the low hundreds consistently. So it was and she was feeling really good, energetic, no brain fog, less pain in her body. So it was really great to help her. She was 75 years old, so she had been living this lifestyle her entire life. So it was really great to see her make the changes, and she started feeling really great, better than she had for 20 years.
Amazing. Now, is it safe to say if someone is actually with type 2 diabetes to be able to get off of insulin, do they
Yeah,
still
they
have
definitely can.
type 2 diabetes if they're off the insulin? Are they managing it, or do they not have it anymore?
So they have type 2 diabetes, but they are managing it through their diet. So let's say they stop their diet or they stop many of their supplements. Yeah, it's going to come back because they're going to start eating a junky diet again. It's cured through lifestyle management, which is the main cause of diabetes, is just eating a poor diet and lack of exercise.
Interesting.
That's the
Well, I'm
cause of
excited
type 2.
to unpack what you talked about and really like slow it down for some of our listeners who might be having, they might have type 2 diabetes and they don't realize it, or maybe they do, but they're really struggling with it like Judy did. So before we dive into it though, I do want to make sure and clarify with our audience that this is just a podcast. Dr. Jake, can you expand on that?
So yeah, this is just a podcast. I'm not going to make any specific diagnoses or treatment specifically for you. This is just some generalities, and how I approach you is going to be everyone's treated a little bit differently. So yeah, if you want to set up a visit with me or some of my associates, visit our website at integrativemedica.com and give us a call.
Wonderful. All right, let's dive in. So, we have another episode that talks about type 1 diabetes, and we've had other episodes where we talk about other types of conditions. I'd like to first just unpack it. When somebody has type 2 diabetes, what's the problem? What's not working?
So what's happening with type 2 diabetes is the cells or the cell membranes of the cells have a decreased sensitivity to insulin, meaning that the insulin doesn't bind to the receptor on the cell very well anymore. So you're not able to get blood sugar into the cells. So blood sugar hangs out in the blood too long, and it can lead to all kinds of issues when it does that. For one, your cells aren't getting the sugar that it needs. For two, when the sugar's hanging out in the blood, it will cause damage to a lot of areas because it causes this chronic inflammatory response in the brain, the blood vessels, the eyes, the organs like the kidneys. All kinds of things can happen. So yeah, so it's completely different than type 1 diabetes. It's not an insulin issue, it's a cellular issue.
So part of the treatment plan when somebody who has type 2 diabetes is it to increase the cell's response to the insulin, or what's the
Yeah,
traditional approach to trying
so
to fix that issue?
that is a part of my treatment protocol, is
Okay.
to help improve the sensitivity of the cells to blood sugar, for sure. The conventional approach, they
Mhm.
don't care about that at all. All they do is want to get your blood sugar low. So they're going to give you several medications to do that. And they don't care really about your diet either. They're just going to say, hey, decrease your sugar. That's all they say. So decreasing your sugar doesn't really mean a lot to people. They're like, oh, okay, I just need to stop eating less treats. But there's a lot of things that have sugar in there. And then they just manage it through certain medications like metformin, sulfonylureas, or insulin.
So what's the problem with that? If somebody were to live their life approaching their type 2 diabetes with the traditional model of just managing, reducing some sugar and taking some insulin, what potential problems could happen?
So you're not really treating the cause of what's going on. That insulin sensitivity problem is going to get worse and worse, and then you're going to have to increase your medications more and more. And then there's going to be a lot of difficulty regulating your blood sugar with medication. Or you're going to have to take tons of medication, which then has a lot of side effects that could go along with it, like fatigue, brain fog, body aches, diarrhea, things like that that could go along with taking the medication. It's not like a medication, if it's blocking one thing, isn't going to lead to something else. It's blocking a certain mechanism in the body, which is then is going to lead to a side effect. Also, the blood sugar dysregulation is going to be a big problem. And then you can't really manage it very well with any other medication except for insulin. And then you have all the problems with the insulin, and you have to really manage how you eat now, and it's really it can be really difficult.
Interesting. Okay, so as far as type 2 diabetes goes, we know that it's been happening earlier and earlier in people. It used to be something that would show up later on in life. We're now seeing it actually showing up in children now.
Yeah.
What's the problem? What causes type 2 diabetes, and why are we seeing it now happening at younger ages?
Yeah, the big cause of type 2 diabetes is lack of exercise, eating too many refined carbohydrates, and eating way too much saturated fat. So, if you think of the American lifestyle, it is what causes diabetes. American lifestyle is lack of exercise, eating a ton of sugar, and eating a ton of poor quality meat, like eating a lot of fast food. Fast food is going to cause type 2 diabetes. It's going to decrease that sensitivity of the cells. So it's going to get all this poor quality fat, and it's going to get all this sugar, and your cells are going to be like, hey, I can't do this anymore.
So
And
I
that's why it's
imagine
happening
with
so young, because they're doing it from a very young age.
right, and I wonder if, this lifestyle of screens, like we've really become dependent on screens so much, and I'm seeing more and more kids on screens, if that is also contributing
Yeah.
to it. We used to like either I think I've seen some memes before in the past where it's like in the 50s, it was these moms dragging their kids inside the house. All they wanted to do was play outside. It's like, get
Mm-hmm.
inside this house. It's time for dinner, or whatever. And
Mm-hmm.
now the problem is we got parents like trying to drag their kids out of the house, get
Yeah.
outside and play. They're they're
Mm-hmm.
they're wanting to stay inside. They want to watch TV. They want to play on their iPads, and they're not getting the exercise that they need. Which I imagine, in addition to the fast food that they're eating, in addition to all the other things that are happening, this is why we're seeing it happening earlier and earlier. Okay, so
Definitely.
traditional approach. Okay, so somebody's not feeling well. What are some of the symptoms somebody might be feeling if they probably have type 2 diabetes? And then what
So the
happens when
most
they go into a traditional doctor?
Yeah, most common ones is they might start becoming really thirsty. They might start randomly losing weight, which they might be happy about, but that's when it starts getting bad is you start losing weight. So you're thirsty, start losing weight, you're peeing a lot, your urine might smell quite fruity, and you might get some headaches, and then you really want to drink a lot of water. Those are the
Okay.
beginning symptoms.
So they're starting to feel this. They go and see a doctor. The
Yeah.
doctor, what's the doctor going to do? What tests are the doctor going to run? And then how's the traditional doctor going to treat them?
Yeah, usually they're going to order fasting blood sugar. They're many times going to order hemoglobin A1C. They're going to get those levels back. Some of the main first medications they go with is metformin or some form of another sulfonylurea to decrease the blood sugar, which works in several different mechanisms. And yeah, and then they keep on checking your blood sugar to see if it's in a good range throughout your life. And if the blood sugar's not good, they're going to manage your blood sugar medications and keep on managing it that way.
So so you talked about what happens if they don't address some of the causes of the type 2 diabetes, as well as, the doctor's really more approaching it on the insulin level, reducing the sugar, versus what is actually the problem, right? The problem is that the body's cells is not responding to the insulin. And your methods of treatment really deal with helping that body actually do what it's supposed to so that you don't have to rely on this insulin. Can you expand? If somebody were to come in and see you, they already have type 2 diabetes, or maybe they've just been recently diagnosed. What's the process going to look like with you with helping them get better?
So depending on what stage they're at and how severe it is, but many times I feel like they don't need to be on their medication. But let's say they've been dealing with this a long time and they're in high doses of medication. I'm going to first start with dietary changes. We're going to work on changing the diet up to help improve the sensitivity of the cell and also decrease how much sugar is in the body. So we're going to put you on a low saturated fat, low carb type of dietary protocol to do that. And then we see blood sugar is going to get lower pretty quick. And then I'm going to start weaning them off of their blood sugar medication. This is if they are on blood sugar medication. If they're not on blood sugar medication, we're going to focus a lot on diet. And then one thing I left out too is exercise. So there's the dietary piece, and then there's the exercise piece. And exercise is a huge piece because it's one way the body gets sugar inside the body without insulin. So
Hmm.
we have these GLUT4 receptors on our muscle cells. And when we go running or we start working out, we pull the sugar from our bloodstream into our muscles. So it really helps regulate our blood sugar in a great way. So if you're like exercising every morning, you start out with a really low blood sugar and it keeps your blood sugar looking good the rest of the day. Also keeps
Interesting.
your weight under control. And the more fat you have, the increased insulin desensitization there is too. So we want to increase the sensitization of the cells so we don't want too much fat. So we want to decrease how much fat we have to help increase the sensitivity of the cells to insulin.
Interesting. All right. The integrative approach really looks at it with diet. What's next? What are some other things that you bring into a possible
So
treatment
yeah,
plan?
dietary protocol, exercise. Many times I give some herbs for extra support, like alpha lipoic acid, really good on balancing the blood sugar, but also help protect the nerves that can be damaged from diabetes. I also like something called benfotiamine, good for balancing blood sugar, but it's really great on protecting the kidneys from damage from blood sugar issues. I also like chromium is really good natural product that can help balance out the blood sugar regulations. Sometimes I use cinnamon. There's some good research on helping that. And
Hmm.
these are great, natural, less side effect profile, and just helping improve your body than the conventional medications.
So if they see you and they get on this protocol, they started, going on this lower carb diet. They're getting on some of these supplements. They might reduce their medication if they're on any. How soon might they start actually feeling better?
They probably, if they're really actually following their diet very well, it will take some time. It depends on where the blood sugar is at. If they're just in the early stages, they're going to feel better just within a week. If they have really high blood sugars, it might take up to a month or two to really get the blood sugars under control and they actually start noticing the benefits of that. So it just depends on the severity of their blood sugar and how severe their decreased sensitivity of their cells is too.
Would you say, I know type 1 diabetes, you can't, you can't be cured of it. Can one be cured of type 2 diabetes?
Yes, you can be cured of type 2 diabetes, but you do that through changing your lifestyle. So let's say you change your lifestyle, your blood sugar's all great, and you decide, hey, I'm cured, and you go back to your original lifestyle, diabetes is going to come back, and it's going to come back with a vengeance. It's not meaning that it's going to be worse than it was, but your blood sugar is not going to be good at all again, and then we're going to have to do all our work again. Yes, changing your lifestyle, you will not have diabetes anymore.
I love that. I love that, there's a common this belief that like, oh, if I'm cured, I can then do all the things that I once did that got me into the problem because I'm cured, when that's
Yeah.
just not how disease works, right? Like
Mm-hmm.
diseases are caused by something. And so, yes, once you're cured, but the part of the long-term being cured is staying away and stopping doing the things that you were doing that led to the problem, especially if you have a propensity to lean that way. I do get jealous sometimes when I see that, some people are able to just eat a bunch of garbage and don't seem to have problems like type 2
Mm-hmm.
diabetes. But I imagine that there's other things going on with them as well that they might have more of a propensity to fall
Yeah.
into. All right. Well, thank you so much for that, Dr. Jake. If somebody is listening to this right now and they have type 2 diabetes, or they're thinking that they do, they're listening to you and they're like, wow, I'm feeling thirsty. I'm going to the bathroom a lot. I'm having some of these issues, and they want to address it. They want to actually solve the problem. How might they get a hold of you?
So yeah, visit our website, integrativemedica.com, find our phone number, give my receptionist a call, and you can set up a visit with me or one of my great associates, and we can get started.
Wonderful. All right. Thank you so much, Dr. Jake, and everyone else. We will see you all next week.
Hey, Dr. Jake, thank you for your time today. And if you enjoyed the show, then do us a favor and leave a review. It helps more people to find the show, which could save their life. And remember, this is a podcast and should not replace personalized attention from a medical professional like Dr. Jake. If you or someone you know has been diagnosed with an autoimmune disorder, cancer of any stage, or a life-changing illness, visit our website today and schedule a virtual appointment with one of our doctors who can lead you to a treatment plan in your area. That's integrativemedica.com. integrativemedica.com.
Thank you for listening to the Integrative Medica podcast with Dr. Jake. To hear past episodes and get alerts for the future, subscribe to us on your favorite podcasting platform, and be sure to follow us on YouTube as well. Just search for Integrative Medica with Dr. Jake.